Hey, Dr. Lefford. Thank you for joining us. And we're going to talk about some important things today, such as when patients need to come see you, when they do need to go to ER or urgent care. Can you explain, please?
Good question. They all have their role. The office visit, is usually for routine care. Sometimes you can get an appointment for acute illness. So if you're not sure and you're feeling ill in the evening, you can call your doctor. There'll usually be an on-call person who can answer a medical question. If they know you, they may even be able to treat you over the phone, or they may say, that needs an office visit in a couple days, let's make you an appointment. Or they may say, that should be seen in urgent care, or this needs to be taken care of in the emergency room. Urgent care is usually for things that you want to get taken care of right away, but are not necessarily life-threatening. So if I'm preparing dinner and I cut my finger, it may need stitches. Not life-threatening, but really shouldn't wait a week either. So I'll go to urgent care and they'll take care of it there. On the other hand, if I'm concerned that someone may be having a heart attack, they're having chest pain and a hard time breathing, urgent care is not really set up to handle that. That's when the ER, which has more testing, availability of specialists, is the right place to go.
Awesome, thank you. Another question we have is, how do you care for your mature population, the population that's maybe don't need sick care, but more like they just feel cared for?
Yes, it's important as people get older, even if they're healthy. We do routine care, which is making sure to keep them healthy, and that may be things like checking their blood pressure, monitoring for diabetes and cancer screenings. But it also can involve getting to know the patient. As people age, they may not be able to take care of themselves, so need to know, do they live by themselves? Are there family members who are able to care for them? What resources may they need? And that all comes into play. May even just need to make the family aware of what changes are taking place or what to expect.
Very important. Thank you for that. Another question people have about can you make them feel empowered about their own health, like being the boss of their own health?
That's an important question. We don't want patients to be passive where they come in and I write a prescription. I want them to, feel responsible and own their health care. So that means getting to know the patient, knowing what their particular individual interests and goals in terms of their health are. And that will be different from patient to patient and may not necessarily be the same as my goals. I may guide them and say, hey, this is really important, you need to take care of this, right. But their interests are also important.
Very important. I agree with that. Question, and the last question, very pertinent to nowadays, is how do you mix your classical medical stuff with holistic approach? Nowadays, very popular.
Well, again, that gets to knowing the patient and finding their interest, and hopefully they can express that. Some patients are really interested in traditional medicine, where they come in and I write a prescription. Others have interests in herbal medicines, acupuncture, chiropractic. That's not my area of expertise, but I can refer them. I can certainly advise them how it may interact with the medical care I'm providing, and we can all work together.
Do you have any example of?
Well, sometimes patients will come in and request a specific medicine. We discussed metformin, which is traditionally a diabetes medicine, but patients may have heard of other things it can be useful for. And we'll discuss that. I can work with the patient. If it's something that I feel is dangerous, potentially risky, then I'm going to really try to steer them away from it. But, we may agree to give something a try if we feel like, this is actually pretty safe and there's not much risk involved in trying it.
I appreciate your answers, and I'm sure the listeners too. Thank you, Dr. Lefford, for keeping it real and for your service for 29 plus years. Thank you.
You're welcome.